This is a topic that we discuss every year, and I try to sort of change up a little bit about some of the focus each year. It's Jed's least favorite topic because he doesn't believe that it's possible to practice wilderness medicine, because how can you have a clinic in the wilderness? And I think his point is well taken, but a lot of this information you might find useful even if you're not in a clinic. So I have nothing to disclose other than that in the past I was an AWS instructor, and both Warren Fitch and I learned a lot in teaching those classes, and so I'll refer a little bit to that, but there are certainly other programs where you can learn this material, so that is my bias. The CME code for this meeting, which I'll refer to again at the end, is 32029 if you want credit. So our goals this morning, I'm going to provide an overview of wilderness medicine, realizing this is a very broad topic and that there are multi-day courses available specifically about it. The one that I know that's coming up in February is the winter meeting of the Wilderness Medicine Society, which is going to be virtual. And so if this is something you're interested in, I think for a fairly reasonable price, you can get much more information. I'm going to talk about some environmental exposure. So people who are from the Southeast are probably familiar with caving and snakes. But if you're not from around here, it is pretty specific to our area. And then some general kind of ideas about personal survival. So if you enjoy hiking, backpacking, skiing in the backcountry, canoeing, kayaking, fishing, all these things can get you kind of in a remote area pretty quickly. And so it is something you should think about before you go out, is what you should bring along with you. And then something our program got involved with a couple of years ago was these mud runs, which have become quite popular. And so I did delve into a little bit of what's the science that we know about mud runs, and there's some interesting kind of evidence about that. And then that led me just to sort of further look into adventure racing as a whole, which we don't have any major adventure races around here, but you might be asked to cover an adventure race at some point. And so it's worth kind of knowing some more about the scope of these things. So what is wilderness medicine? Again, the whole idea here is that you are away from all of your major resources. And so I think sports medicine is a good example. When we're on the sideline, we don't necessarily have as many things available to us. Now you could argue football is almost a mobile clinic at this stage, but I think of wilderness medicine as like extreme sports medicine, where really it's just what minimal things can you bring along, and you really have to kind of work with what you have. But it includes multiple areas, include disaster medicine, dive medicine, search and rescue, altitude illness, cold and heat related illness, wilderness trauma, and then kind of the thing that interests most people is kind of animal attacks, which we'll talk a little bit about, but that will not be the focus. So there are unique sort of risks and safety issues in these different environments, whether that's mountains, jungles, deserts, cave, marine, space. And, you know, nowadays a lot of these things are much more reachable than they used to be in the past. And so, you know, in a day's journey, you can be in any of these kind of extreme environments. So different areas, again, to sort of be aware of these unique aspects of where you are. High altitude, which we won't talk about today, but, you know, how does hypoxia affect the body? In the sports medicine world, you know, people have tried to use that to their advantage. And so it's good to kind of understand what the physiology of hypoxia is. Hypothermia and hyperthermia are things we have to worry about in most areas, regardless of where you live, and how that again affects your body. Interestingly, last year we had trouble with our lacrosse team when they went to Denver and the temperatures were so low they actually couldn't participate per NCAA rules. So it's kind of, again, interesting how this might affect us in the sports medicine world. Certainly with heat illness is something we have every year with football in the fall. Tropical environments, so that is mostly has to do with the unique organisms that live in those environments. Aquatic environments, which has most to do with dive medicine, but also can have to do with large animals. Lightning, which is something, again, in our area of the country that we have to be aware of, and most of our athletics have protocols in place about clearing the field in the setting of lightning, and so understanding kind of what the rules and recommendations are. The most common, being the flash to bang time period of 30 seconds means the lightning is within 6 miles and the event should be canceled. Obviously, we have much more sophisticated technology now with lightning trackers that can give actual distance. But again, understanding who's in charge of calling off the event. And then finally, underground, which is what I'm going to talk about today, only because caving is a kind of a big part of what goes on recreationally in the Southeast. So it is quite common to our area. So I mentioned aquatic. Again, where we are, we don't have any ocean water to worry about, but we do have a lot of freshwater sports, kayaking, lake sports. But one of the phenomenons that's interesting around here is in the spring when all the creeks become rivers, you have people that are coming here specifically to kayak these creeks. Certainly, drowning is an issue regardless of the body of water that you're kind of dealing with. And so this comes up when we talk about some adventure racing and making sure you have the appropriate staff to deal with a water activity. Certainly boating is a big thing around here. And then again, I mentioned scuba snorkel just because you may have people that fly somewhere to go diving and then fly back to Nashville and have trouble. And we do have a dive network with contacts here in hyperbaric chamber that's at St. Thomas. So just a word on travel. And I think, again, right now it's not really all that sort of useful because there isn't a whole lot of travel going on, but it's good to understand if you are going to a remote area of the world, what diseases are endemic to that region. And CDC has really good information on what immunizations or medications are recommended. Vanderbilt has a travel clinic, which is nice if you have to get some of these strange vaccines, but it is a challenge to get into. And so if you know you're going on one of these trips, you really need to book your appointment months in advance in order to get in time. So what about some exposures? Again, I just picked a myriad of things on here, some of which are specific to our region. This was a hike that Jed and I went on in the advanced team physician course. And so again, it may be one of these things that you show up in a place and there's something you need to be aware of that isn't kind of common where you are. And so trying to understand that about your area, I think, is useful. So normally I ask people to identify these things, not as easy in this sort of format, but some issues that we run into that you should be aware of. We do have scorpions in the Southeast. There are small scorpions, not large ones, but they can sting, and it is unpleasant. And so they typically like to live in kind of moist, dark places. So people's shoes are kind of the most common example that I've heard of people getting stung. And so when I worked at a summer camp, we used to have to check all the kids' shoes before they got dressed in the morning. And there was always a good story or two about scorpions being found. If you're familiar with the animal to the right of that, that's a copperhead, again, endemic to this area. I was reminded that this is actually the time of year that the babies are born. And so One of the things we'll talk about with snakes is oftentimes mature snakes don't tend to envenomate humans like immature snakes do, because the venom is really used to kind of kill prey. It's not used as a defense. And so again, baby venomous snakes tend to be much more significant bites. There is the honeybee down there in the bottom left. Again, just one of these kind of interesting things to understand, that when you're stung by a honeybee, they leave their stinger in place. And so you don't want to try to grab the stinger with your finger, because what you do is you squeeze the little venom pouch and you actually put more venom in. And so you're supposed to take some sort of object, typically a credit card or driver's license, and scrape the stinger off. Poison ivy is the next thing along. It is, I think, in every state in the continental U.S., but certainly grows really well in the Southeast. And so it's good to be aware of what it looks like. The mnemonic being leaves of 3, let it be. But if you're allergic to this, this makes me itch just looking at it. I put a picture of the black bear. If you've been to the Smokies, this is something that is not unusual at all to see. Typically, we don't see black bear attacks like we see brown bear attacks in places like Alaska, but the black bear has made a comeback, and so it's not unusual at all to see them out and about. And then I put a picture of something that is not endemic to our area on there, just to remind us that you know, our athletes do travel. And so this is a sea urchin, which one of our lacrosse kids stepped on while surfing in Mexico on spring break, and came back with a bunch of these spines in her heel that I had to remove. And I didn't know much about it, so I had to look it up first. So just again, to remind us, you know, all these things are different, and if you're not familiar with it, look them up. There's a great wilderness medicine textbook that was written by an ER doc from Vandy that I highly recommend, which I'll refer to at the end. So I wanted to talk a little bit about snake bites, again, because it is something that is quite common in the Southeast. It's not unique to our area. I would say the Southwest is also a place that you need to be aware of this. But 3 main venomous snakes in this area: the cottonmouth water moccasin, which is there with its mouth open, hence the name; the copperhead, which I think is a really pretty snake, but obviously venomous and pretty good at hiding. And so oftentimes these bites occur when you step on the snake, and it's a defensive strike. And then the rattlesnake, which I think most people are aware of because it makes a sound. What's interesting is we have a specific rattler in the Southeast called the Eastern timber rattler that is, again, different from other rattlesnakes in other areas of the country. And then the other venomous snake to be aware of is the coral snake, but it's really not in Tennessee. It's more on kind of coastal areas. So if you're going to Florida, something to be aware of. And then on the lizard side, the Gila monster, again, not in the Southeast, but in the Southwest. So coral snakes, just briefly, again, because it's not something we see around here, but it's worth kind of understanding, is their color pattern. And so the coral snake, the bands of color on the skin go red, yellow, black, yellow, red. And so you can see kind of this distinct pattern. Whereas there are other snakes that have the same colors, but a different band pattern that are non-venomous. And so, again, the saying is red on yellow, kill a fellow, red on black, venom lack. But with most of these things, if you get it reversed, you're going to be in trouble. And so I just say, if they're red and yellow and black, leave them alone. Again, these tend to be much smaller snakes, but not around here. So what's the data on snake bites? And so what's very kind of interesting that hasn't changed over time is that most of the bites that occur are from people who intentionally handle snakes. And so if you do spend time in the wilderness, it is quite unusual, even if you come across a snake, if you don't handle it, to be bitten. Because again, most of the time the snakes are scared of you. They're trying to get away from you. And so it's only if you're trying to capture them that you are really in danger. And the guy I put there at the top is a snake handler. And so in northern Alabama, and I'm not sure if it occurs in Tennessee, but there are still some religious practices where snake handling is part of that practice. And this is a family of preachers from Stone Mountain in Alabama, where the grandfather was a preacher killed by a snake. The father, who's this guy, was a preacher killed by a snake, and now the son most recently has suffered the same fate. And so again, not something we would necessarily commonly come across, but does still occur. So lots of snake bites, interestingly, but very few deaths, and really none recently. And that's because of the development of antivenom. And so you do see local tissue damage, but really beyond that, really minimal risk of death. And you can see for coral snakes, much less. So how do you identify these venomous snakes? You know, certainly one approach is if you see a snake, just to sort of keep your distance in general. But for the pit vipers, which are the venomous ones around here, their head is very triangular or heart-shaped, just like this rattlesnake in the picture. The eyes have cat-like or slit pupils, so you can see it on this snake. And then my favorite is that the scales on the bottom of the snake, and venomous snakes have a single row like it's pictured here, whereas the harmless snakes have a double row. So if you really want to be sure, pick up the snake and flip it over, which will make it really angry. But most of the snakes that you see that that are not venomous, their head is more sort of flat shaped, their eyes are round, but I don't suggest lifting them up and checking their scales. What's pretty cool is a lot of these non-venomous snakes are aware that people are afraid of venomous snakes, and so they will imitate venomous snakes. So some of them flatten their heads to make them look more triangular shape, and some of them will shake their tail even though they don't have a rattle to make them look like rattlers. So what is in the venom? You can see it's a mixture of things, proteolytic enzymes, thrombolytic enzymes, all these enzymes that break down things. And so it is very destructive from a tissue standpoint, again, primarily locally. But what causes problems more systemically is clotting. And so that is the reason to use the antivenom. So again, primarily what it does is tissue damage. So what's the treatment? Probably the main message is get to a medical center so that you can have access to antivenom. And everything else is kind of, yeah, you can try some other things, but it's really about time. So the saying in this setting is time is tissue. So the longer you wait, the more potential tissue damage. So you can do other things. Most of the stuff you're not going to have available, but really limiting activity. So it's really about extricating yourself, removing any tight jewelry or clothing because of the potential for swelling. And then just like with cellulitis, you can mark the border for advancement. Venom extraction, it's interesting that this still gets kind of attention when there is really no evidence to support use of these devices. And so if you are taking the time to mess around and try to do this, it's just longer that you're waiting to get to a facility that you could get antivenom. And so really it's probably not worth the time. But a couple of kind of just good rules is don't use your mouth, because then you're just transferring the venom from one area to another, and don't incise the bite site, because again, you're just causing more tissue damage. There is some sort of recommendation to apply a very light pressure dressing and to keep the bite below your heart. But beyond that, it's really get out of there and don't apply a tourniquet. So one of the general rules, if you're in the emergency room, you're probably familiar with this, but the idea here is treat the bite, not the snake. And so the thing to understand about that is whether it's a copperhead or a rattlesnake or a water moccasin, doesn't matter as far as the anti-venom goes. The anti-venom treats all of those snake bites. And so oftentimes there's a delay in seeking care because people are trying to capture the snake or are trying to capture the snake and somebody else gets bitten. And so again, what the snake is really doesn't matter at that point. Historically, the anti-venom was made from horse serum. And so I think if you're familiar with this, there was a lot of serum sickness associated with that. And so what's changed now over time is how the anti-venom is made. But again, that is the main treatment. So the new one is made from sheep serum, which has a benefit of much less serum sickness associated with it. And again, it's using all these major venomous snakes. The trade name is Crowfab. And again, depending on where you are, this is available quite readily. Again, there is a separate anti-venom for coral snakes, which again, we don't have in this area, and so probably we're not going to have anti-venom for it. So if you have questions about snake bites, I'll just ask you to jot them down, and we will have some time at the end for questions. So the other thing that I wanted to talk about in this area is caving or spelunking, and this is the idea of getting in a tight space and following it around. In the UK and Ireland, they call this potholing, which I just think is a great term. But we do have several national parks with caves. So again, not very far from here, you can get a guided tour through one of these caves. So again, lots of people are doing it. What are the challenges? Again, tight squeezes, obviously darkness, so having a good light source. Water oftentimes is what causes these caves to form, and so depending on the time of year and the weather locally, it may be wet or not. But that's, you know, how these caves come about. So the reason it's so common around here is the bedrock is limestone, and so oftentimes the water is running through the bedrock. So you have, you know, even large underwater rivers. Obviously mud, which is part of the fun, and then critters that are unique to caves, which we'll talk a little bit about. So what are the common spelunking injuries? Again, probably most common is getting lost because your light goes out. And so making sure that you have a backup light source. Hypothermia, again, caves are constant temperatures, and so it's not so much that the temperature is low, but if you get wet in the cave and you aren't dressed adequately, it becomes more of an issue. But probably most common thing is falls. And so again, because you're in a wet, muddy environment, it's quite easy to go down. And then there are some unique sort of things to consider that people have caught in caves. Again, probably the one that most people are familiar with is rabies from bats. But bats also carry histoplasmosis, and so particularly with bat guano, this is how this is passed on, but also documentation of leptospirosis and tick-borne fever associated with spelunking. So what about some data from caving? And again, as you'll notice with a lot of these wilderness medicine studies, these are based on either incident reports or surveys. But the idea is to sort of get some overall idea of the epidemiology. So not too surprisingly, most common in the summer. So again, you get in a cave and you get respite from the heat, but falls quite commonly, and you can see kind of a myriad of different things there. Again, survey data that is quite old, but you can see again 10,000 members, about 300 responded, so not a great response. In this group, about a third had had an injury while caving, with hypothermia being the most frequent, followed by fractures, bites, and concussions. Again, a pretty low injury rate. And those with more experienced caving, not too surprisingly, had lower rates. So what about some equipment? I mentioned the light and a backup light, certainly having a map. A lot of these caves have already been mapped, and so if you have that going in, you're much more less likely to get lost, or going with a guide. Again, the national park that's not too far from here requires guides. Having helmet, good shoes, gloves, again, this protects you again against falling. And then I mentioned if you're going to be in a wet cave, making sure your clothes are waterproof. The marker tape can be useful if you are going out the same way you came in, to just mark some specific rocks so that you know that you're going out the right way. So what are the caves around here? Mammoth Cave is a national park just over the state line in Kentucky. Cumberland Caverns in McMinnville, Tennessee is a state park. The newest one I'm aware of is the Caverns, which is in Pelham, where they play music underground, at least before COVID. But they do offer cave tours. There's some smaller caves, again, in the same area. But if you're interested in this, there's a website where you can look up more information. Unfortunately, a lot of the caves around here are closed, and they're closed because of what is called white nose syndrome in bats. And so this is something that has been around for a little while, first noticed in New York in 2006, but really has spread around the country. And so a lot of caves have been closed for visitors because that is how this was being spread. And so somebody would go into a cave in one place, and then wear their same shoes into a cave in another place and spread this fungus around. And so multiple species are now extinct because of this fungal infection. And it's named for, again, this white fungus that is seen on the nose. So again, if you have caving questions, please save them till the end. The next topic I wanted to cover is adventure racing. And again, I think this is a useful thing to be aware of, although I don't think a lot of these things are going on right now. But again, depending on where you practice, you may or may not have these things going on around you. So what is adventure racing? It's really kind of a wide spectrum of things. This can be a simple mud run from a couple hours to a more expedition type race that lasts a couple weeks. But principally this includes hiking, mountain biking, and paddling are kind of the top three. So there's a famous triathlon just south of here that involves those things. But depending on where you are, they may throw in some different other activities, including rock climbing, rappelling, horseback riding, skiing, or rafting. So again, if you're covering these events, you have to have people that are experts in search and rescue in these different sort of areas. So what about the history of adventure racing? This goes back into the 60s in the UK, where it was a 2-day race with a team of people where you ran a marathon each day, which I can't kind of imagine having to do a marathon right after you've done a marathon already. But crazy things that people are doing now. In the 80s was the advent of the coast-to-coast race in New Zealand, where you cover 150 miles, including trail running, cycling, and paddling. Also the Alaska Mountain Wilderness Classic, which again, 150 miles of unsupported wilderness racing. And then something that occurs around here called the Barkley Marathons, which is in the Smoky Mountains, started in the 80s, but still goes on today, which is you run 5 20-mile loops back to back, and you have 60 hours to complete this task. So it's a little less than a marathon. And only certain people qualify for this. So I think it's limited to like 100 people every year. And each year, either one person or no persons tends to finish. And so just finishing this is a feat in and of itself. And if you're interested in learning more about it, there's a Netflix special about it. It's just kind of amazing that it still goes on. Some other things out there, RAID geolosis in New Zealand, the Eco Challenge, which I think is when this first became more widespreadly aware because it was televised. And in the 90s is when the U.S. Adventure Racing Association was formed. And so this organization I just bring to your attention because if you are going to be covering a race, you want to make sure that they get certified by this organization, because that means they have certain safety practices in place. They do have a national championship, they have a World Series, and then it's just kind of spread all around the world now, where you can find these events quite commonly. So I mentioned it is a spectrum, so you can see kind of, again, from the 2-hour minimum up to multiple weeks and everything in between. But I highlight the 2 to 6 hour race because that's what you're going to see most commonly and that have really gained in popularity most recently. So a couple rules about adventure racing in general: that you can't have any motorized travel, you can't use GPS, you have to travel with your team within a certain defined space, and you can't have outside assistance. So what's interesting is other teams can help each other, but no one from the outside is allowed. So you can see here in an adventure race where the teammates are helping this one injured person, but you can see they're all on the same team. This is all also from a Netflix series where this dog followed this team of racers and then they adopted the dog. So mud runs is really what I wanted to kind of bring up because, again, we were asked to cover the local one here several years ago and our fellows participated. But these are the three sort of common ones: the Warrior Dash, the Tough Mudder, and the Spartan Race, all kind of started at the same time. Again, these are fairly short races, but you see these things pop up that, for fundraising or just to draw attention to a specific topic, people will have a mud run. And so, again, there's a nice website which lists all these things if you want to find out what's going on in your area. So what about the Tough Mudder? So the Tough Mudder is a little bit longer, usually in the 10 to 12 mile distance, and it includes certain obstacles. So fire, water, barbed wire, electricity, and heights. And so here is the electric obstacle where you have to do a commando crawl through mud, and if you get up too high, one of these wires will electrocute you. So you can see that's pretty exciting stuff. I like how the fact there's a bunch of people watching this particular obstacle. You can see a large number of participants, in the tens of thousands, and total participants in the millions. So again, if you're covering this, you need to be sort of familiar with the obstacles. There is the Spartan Race, and you can again see a wide variation in distances, but also includes obstacles that are similar: fire, jump, barbed wire, wall climbing, mud crawl, spear, throw, rope climb, heavy obstacles, monkey bars. These don't seem quite as crazy to me as some of the other ones. But one of the beauties of this race, I think, is if you aren't interested, then you just do 30 burpees and you can go around the obstacle. So I feel like that's a fairly nice out if you don't think it's safe. So what do we know about some of these races? In the early 2010s, there were a couple of deaths, and one was due to drowning and a couple due to heat stroke. And I think this kind of brought attention to the risks involved in this, and particularly with the mud. And even though there weren't as many deaths, there were several people that were paralyzed by diving into the mud. So you have this mud pit that's associated with it, that the water is dirty, and so you can't see the bottom of it. And so people were mistakenly diving in thinking it was deeper water. And you can kind of put this in context with other mass racing events like marathon and triathlon, and kind of see the data that, yeah, certainly there are cardiac deaths in marathon and certainly there are drownings in triathlons. But again, this seems to be sort of some unique issues related to mud runs. And then I looked this up again, trying to get some overall epidemiology on adventure racing and mud runs. And what's interesting is what comes up is mostly infectious disease. And as I go through this, you'll see sort of certain patterns that occur. And so this is a paper from 2016, which is an adventure race in Europe, where they had acute gastroenteritis breakout after the race. You can see of the 8,000 people in this race, 1,200 of them got this disease. And so they were able to test stool specimens and norovirus breakout. So interestingly, this was a case where it was transmitted from human to human and not from animal. So again, probably within the mud pit. Here's another example from 2012 in Nevada with a Campylobacter outbreak in an adventure race. This was a military race. And you can see from the public health department in this area, 22 cases of Campylobacter that occurred in this group. And again, what predicted it was swallowing muddy water. And so again, just participating in the race, your risk was high. A leptosporidium outbreak, another adventure race in 2010 in Florida. And again, in this case, it wasn't mud, it was just river and swamp water, but again, a pretty high risk just from participation. A couple studies on Rabdo and adventure racing. This is where they were kind of monitoring muscle breakdown, so specifically myoglobin. And then interesting, they looked at anti-inflammatories. You know, this is a topic that's come up in running races, particularly marathons, about whether people should or shouldn't be using anti-inflammatories. But interestingly, what correlated was that you had a significant rise in your myoglobin, which is not too surprising. Less so in the non-NSAID group. The people who are using anti-inflammatories, not too surprisingly, were the slower people who tended to have more pain probably, and so they had much longer race time. So again, that might also correlate with muscle breakdown. Some kind of further look at this was this Bear study, again, looking more at muscle breakdown and kidney injury. They kind of have some definitions of how they break this out as calling something acute kidney injury. But you could see again that both creatinine and myoglobin were elevated in this group. And again, they had deemed them at risk and injury just based on their own kind of thresholds. But not too surprisingly, your creatinine went up, and that there's a trend towards more kidney injury with NSAID use. So I think it just supports the idea that probably you shouldn't be using NSAIDs and doing any kind of racing. What about other injuries in adventure racing other than the infectious disease? You can see this is a large race where they had almost 17,000 race hours, and you can see the number of injuries was actually pretty low, 60 cases of injury illness. Most common was respiratory, so I assume asthma as to why people withdrew. But again, pretty low overall rates in general. There's the Primal Quest, again, one of these televised events. You can see this was more of a team event over almost 2 weeks. And most common injuries in this group were soft tissue blisters. So kind of same things you see in kind of hiking and backpacking in general. So I think, again, the idea behind looking into this was to really think about coverage planning. And if you're going to be, again, the medical director for one of these events, what do you need to think about? And so if water is part of the course, then you need to make sure you have lifeguards present. The youth triathlon that we have covered in the past that takes place in the pool in Centennial Park, we have lifeguards there. Having plenty of boats support. So oftentimes, again, you just have a swimmer who's in trouble, who's tired, who needs to be removed. And so having plenty of boats around along the course is very helpful. Again, what about the mud? You know, the mud run around here takes place on a farm where there's cattle. And so it's not too surprisingly that you might find, you know, things in the mud that would be unpleasant if you ingested them. And so should we be testing that before, you know, we agree to have a race there? And again, we're no longer involved in that particular race, but it's something that I would have recommended. If you're doing any kind of climbing or rappelling, making sure that you have people that are, again, trained in that can do search and rescue. Removal from the pit. So I mentioned the mud pit, which is kind of a big part of all these races, is that, you know, we practice doing spine boarding from different environments, whether, you know, that's the field typically or the ice in hockey, but also something to practice, you know, from water. Which is a lifeguard we did, but I've never practiced doing it from a mud pit, which I got to think has its own unique challenges. And then finally is evacuation, making sure that you have a means of getting people out of there. Again, the farm where this mud run took place, we had to have ATVs to get the people out to where the ambulance was, because the ambulance couldn't go back to where the people were. So having a method of evacuation is really important. Again, I mentioned some resources early on. So the U.S. Adventure Racing Association, to me, is probably the most important part to this, and making sure they're registered with that group and meet certain safety standards. ACSM Team Physician Consensus Statement does have some information on mass event coverage that's useful. And then I'm going to wrap up with just some kind of general wilderness medicine things, again, just to make you aware of some data that's available. Again, some of this is just similar to the adventure racing data, in that it's survey data or injury specific data from a specific group. So this is from Boundary Waters, U.S. Forest Service data, and you can see kind of their list of common injuries. Again, none of these things are spectacular by any stretch, but you can imagine if you've got a sprained ankle and you got to hike out, how it might be problematic. Or if you're hypothermic in the wilderness, you know, how do you deal with that? But again, these different things, whether they're insect bites, poison ivy, blisters, sunburn, can be an issue depending on where you are. This is some data from Widgewagon, which is the YMCA camp. And you can see here, they do a lot of hiking, 10,000 days on the trail with 20,000 participants. In this group, a small number of illnesses and injuries, but 12 evacuations. So again, if you have to do this, it can be challenging to get somebody else out. Again, most common injuries: sprains, strains, lacerations, and illnesses. So what about search and rescue? Depending on where you are, there are search and rescue squads that are trained to do this. In this area of the country, there are actual cave search and rescue groups, because it is, again, such a unique environment. And so, again, depending on what event you're covering, you may want to have these people available. Some good kind of rules about this for prevention is, if you are going to be going into the wilderness to do whatever, whether it's hiking, fishing, kayaking, that you leave the date with somebody that you are leaving and the date that you're due back, so that if you don't show up, people can at least go looking for you. Having some sort of signaling device available, and the signal mirror is probably the kind of classic one that is simple and doesn't require a battery to work. Obviously, if you have a sat phone, that's a different kettle of fish, but not cheap. And again, if the battery isn't working, you got a problem. So some basic survival skills that are worth kind of understanding and practicing. First aid, so, you know, treating a laceration, treating a sprain. Water collection skills. So if you don't have access to water, having some way to collect water, number one, and then make sure the water is not contaminated. There are some pretty cool devices now, you know, these UV pens that you can put in your water bottle that kind of clean water that's much easier than some of the older methods. But boiling obviously still works. Chlorine and iodine still work. some way of producing heat. And so fire starting when I was a Boy Scout was kind of one of the skills that you had to learn, and that I think is a valuable skill even now, because if you can collect water and you can start a fire, then that really kind of improves your mental outlook. Again, probably one of the most common mistakes when people get stuck in a situation is panicking and making a bad decision. And that's much easier if you're hypothermic and not thinking right. So again, knowing some of these basic skills is good. As far as planning goes, a basic survival kit. So I mentioned this early on. Having this kit that has fire starter in it, has some way of cleaning water, should be a bag that you take with you if you're going to be going into the wilderness. Basic medical supplies. I can tell you, if you are a physician or any medical provider and you go on a group trip, you're expected to provide medical care whether you signed up for that or not. And so making sure that you bring some of these things along, which I'll review next. I mentioned immunization, so checking ahead of time to make sure everybody's got their shots. The most recent time this came up was when our basketball team went to the Caribbean, and this was in the time of Zika, and obviously chikungunya is still pretty common down there, and so there were people who elected not to go based on what things were endemic at that time. And then communication. So I think I alluded to the fact of kind of leaving your entry and exit data with somebody. Cell phones we all use and think work everywhere, or at least think they should work everywhere, but oftentimes they don't work in the wilderness. And so relying on your cell phone is not foolproof. And so just making sure that, that you communicate what your plans are. So I mentioned the basic survival kit. You can see on here, you can buy these things from REI or various other companies that sell them pre-made. I think it's a good idea to sort of take a look through what they put in theirs and kind of make your own, because you're more familiar with what's actually in the kit, and don't assume something's in there that's not in there. But you can see the list here, which I won't go through. A couple things I added to it. The SAM splint I really like, which if you're not familiar, is the aluminum sheets that are covered in foam that come in a roll, and most athletic trainers have in their kit now, because you can make essentially any kind of splint for lower extremity, upper extremity, even cervical splints out of them. Basic medications. Again, none of this is spectacular, but just being aware that, carrying the over-the-counter stuff along can come in very handy, whether that's, treating common illnesses or allergies or just aches and pains. And having some sort of broad spectrum antibiotics along can be very helpful. So again, I think if you're going on a group trip, it behooves you to bring some of these things with you. And finally, I'll end up with resources. So I refer to the CDC already. They have a great website for travel that you can look up the country that you're going to and see what specific things are endemic and what immunizations are recommended. Paul Auerbach, who's an ER doc at Stanford, who wrote the wilderness medicine textbook. Unfortunately, it's a very thick textbook, so it's not very transportable. But you can look most of this stuff up now online. Again, if you want more training in this, NOLS, which is the National Outdoor Leadership Group, does training in wilderness medicine. The group that Warren and I had worked with in the past, Advanced Wilderness Life Support, has good training. And then the Wilderness Medical Society, I mentioned their upcoming meeting in February that will be virtual. So again, if you have interest in this area, there's much more stuff than what I covered today. And you can even now do certification and become a fellow in wilderness medicine if you really want to get into it. So I'll wrap things up and just provide you with the CME code again. 32029 is the number that you text. And I'm going to open things up for questions or comments.
Dr. Gregory, thank you for that talk. In this area, as people are hiking and going on these adventure races in the local area, is there much risk for the high altitude related illnesses? I'm not super familiar with the Smokies and what type of elevations where we see here in Tennessee.
Yeah, so good question. You are safe. So really the issue is when you fly to Denver to go skiing with your family, and you fly into Denver, which is obviously mile high, so over 6,000 feet, and then you drive up very quickly to where the ski resorts are at 12,000 feet. And so us lowlanders don't tolerate that very well. And so if you live there, you know, it's not a big deal at all. But if you're traveling there, and particularly with children, they tend to be affected more by it than adults. So probably one of the best things you can do is, if you're going to do that, spend the night in Denver before you drive up, which allows your body some time to acclimatize. Drive up the next day and probably not ski that day, and not ski until the third day. Now, everybody wants to fly in and get their skiing in and fly out and go back, you know, to their lives, but that's practically probably not the best way to go about it if you want to avoid what is altitude illness. And the most common one is acute mountain sickness, which is just headache, malaise, and, you know, in a child that can kind of foster itself different ways. But the only real treatment is oxygen. And so you either have to go to seek medical care or drive back down the mountain. You know, there are places now that offer, you know, oxygen therapy at great expense, as you might imagine. But we're safe. The highest you can get in the Smokies, I think, is 5,000 feet at Mount Mitchell. So you don't really need to worry about it around here, but it's not very far away. New Mexico, same thing. So for us as sports medicine docs, when our teams are traveling to Denver or Albuquerque to play, it can cause real trouble in the athletes.
Yeah, perfect.
Thanks for your question. Anybody else?
Andrew, it's Paul.
Hey.
Hey, so hey, great talk. I had one thing just to add is, like you talked about, you know, knowing what's, you know, if you're going to be covering these events, you know, knowing the courses and just what's going on. This is an interesting personal story I had that kind of go along with that. Was when I moved and lived in northern New Hampshire, there was a triathlon that they had in the local community, and there was no coverage for it. And we actually, I participated in it, and it was a little bit different. It was you mountain bike first to the base of the mountain where there was a spring-fed you know, lake that you swam across, and then you ran or hiked up a mountain. And so a little bit different than swim, you know, bike run. It was bike, swim, and then hike or run. And one of the potential downfalls was, I personally experienced, you're all sweaty, you get off your bike and you jump in this cold lake, and it's probably about maybe 60 degrees water. And I got into the middle of the lake and I just totally cramped up. And I mean, literally I was like, thought I was going to drown because I couldn't move. Luckily they had some like boats in the middle of the lake that you could, you know, that were kind of stationed across. And luckily I was able to make my way to one of these boats because, you know, I was kind of I was panicking because I was going to drown. And so luckily I got across with the help of one of the boats and you know, and was safe. But the next year in my training for this thing, I realized that if I had moved like 10 feet over from the middle of the lake, I could stand up. So it was amazing to me the next year when I did this, that I actually swam a little bit over on the side and was stood up for a little bit. And all the people that had done this for many years didn't realize that, you know, you could actually do that. And so just knowing your course could save you a lot of headaches if you're covering it or actually participating in it, so that you don't you don't end up drowning in the middle of a lake. So I just thought I'd add that to to the situation.
Thanks, Paul. Did they disqualify you because they had to help you, or did they let you finish?
No, they let me finish.
Yeah.
But it was interesting. Like, I mean, like being personally experiencing, I mean, you think, oh, you train for this and things going to go smoothly, but anything can happen, obviously. When you're in the middle of this, you like you said, panicking is not the best thing, obviously, but luckily I didn't panic, and I was able to make my way over. But it was a pretty scary event. I mean, because I literally, my whole body was cramping, not just my legs. I mean, my arms were cramping, and I luckily, like I said, was able to not panic and get to help. It's a kind of a helpless feeling sometimes if you're in the middle of a body of water and you can't touch bottom, And so, like I said, the next year when I trained, I learned that I realized, hey, move over 10 feet, you can actually stand up and save a life.
Yeah. Also, good reminder why it's important to have boats around.
Yeah, exactly.
Thanks. Anyone else?
I just wanted to say I got a text from Dr. Shackelford, one of the walk-in clinic physicians who was listening in earlier. He had to step off, but I appreciate it, and I'm curious if some of the walk-in team members have found it helpful to get a reminder on some of the microbiology. You have to admit, histoplasmosis and leptosporidium would not be some of the first things I'm thinking about when someone's having a respiratory or malaise type symptoms. So different testing and different coverage for treatment. Great reminders there.
Yeah, probably, again, a unique thing where involving our infectious disease colleagues would be really helpful. Yeah, also Ed posted in the chat about there are caving clubs, which if you're interested in, you can go caving with the club, and it's probably a safer way to approach it for people who are familiar if there's not a guide per se. All right, we're going to wrap things up based on time, but I wanted to thank everybody for joining in. And again, if people have specific questions, you can email us directly. Our emails are on the website. So thanks. Have a nice day.